Hi, everyone. On behalf of the CLL Society, I'm Alan Skarbnik from Novant Health, and I'm here to interview Dr. Jennifer Woyach on a very interesting abstract, abstract 4622 LP168, Rocbrutinib, a novel covalent and non-covalent next-generation inhibitor of Bruton's tyrosine kinase, updates on the phase 1 trial and initial results of the CLL gatekeeper mutation cohort. So, Jennifer, thank you for participating in the interview. This is a very, very innovative concept. Can you talk to us about the study?
Yeah, thank you. Hi, I'm Jennifer Woyach from The Ohio State University. This was a really exciting phase 1 first-in-human clinical trial of LP168, now known as Rocbrutinib. So Rocbrutinib is a new version of a Bruton's tyrosine kinase or BTK inhibitor that actually has dual function. So in the presence of wild-type BTK, it can bind covalently or irreversibly, just like ibrutinib, acalabrutinib, and zanubrutinib all bind. What's interesting about this molecule, though, is that in the setting of a C481S mutation in BTK, so the mutation that commonly can cause resistance to those covalent BTK inhibitors, Rocbrutinib can actually bind reversibly in that setting. And as well, with this reversible binding and the irreversible binding, it was predicted structurally to be able to inhibit BTK not only in the presence of the C481S mutation, but also in the presence of T474I mutations, which can drive resistance to non-covalent BTK inhibitors like pirtobrutinib. So in this study, we've treated about a little bit less than 40 CLL patients, and it was a very heavily pretreated patient population. Of course, many of the patients on the trial had received a covalent BTK inhibitor and even a non-covalent BTK inhibitor and venetoclax. The initial dose finding is complete with 300 milligrams currently being thought of as the phase 2 dose, although probably further dose optimization is going to be needed in subsequent studies. But for patients who received what we think of as the more therapeutic dosing, the response rate was over 70%. And importantly, we had a number of patients who had the T474I gatekeeper mutation, and they also had a response rate that mirrored what we saw with the entire patient cohort. Now we do have data where patients are approaching 3 years of treatment, and the drug seems to be very durable in this setting, with many patients over a year of treatment, a number approaching 3 years of treatment. This is a very selective BTK inhibitor, so actually has been very well tolerated too. And we've seen very low, or I think maybe 0 patients with atrial fibrillation, and seen low rates of hypertension. Bruising, of course, has been seen, and then some other things that are sort of typical to CLL studies, like upper respiratory infections and things like that. So overall, I think it's a very exciting new molecule, and we look forward to further studies both in this setting and then hopefully combination studies too.
There's a really cool concept. I imagine most patients have received a covalent BTK inhibitor before, right?
All of the patients.
All of them. Yeah, it's very interesting, this dual effect. I mean, it's how the drug can block one, and if that's not blockable, go to the other kind of the mutated part. It's very, very interesting. Do you think that, I know it's like all the data for this is still cooking, but you know, at this point, if you had a BTK degrader in your hand or something like this in your hand, where do you feel this will go?
You know, I do think that it is appealing to try to kind of maximize the BTK inhibitors potentially before the BTK degraders, because you should be able to use a BTK degrader after a drug like this. So I can see it really in 2 fashions. Like one, maybe post-COVID or post-non-covalent BTK inhibitors, maybe prior to a degrader, but also with the potent covalent inhibition and the selectivity of the drug, I think it's actually really appealing to study even earlier in treatment, maybe even in the frontline setting by itself, or really maybe preferably with a combination partner.
That sounds phenomenal. Remember us when this trial is going on and thank you for participating.
Absolutely.
Sounds like a good drug. Well, thank you very much, and hope to see you soon.
Thank you.